The nurse is caring for 5 clients on a telemetry unit. So we're having a busy day on this unit. Which of the following client needs can the nurse delegate to a UAP? So I'm not even going to overwhelm you guys by reading all of them at once. Let's just go through them one by one and see what we think. Option 1, determining the pain level for a client that just received IV morphine. Yes or no? Do I want to delegate this to a UAP? Determining the pain level for a client that just received IV morphine. This right here is actually kind of tricky because when we're evaluating whether or not, or we're going back to ask a patient how their pain is after administering a pain medication, we are actually evaluating the care plan. We are evaluating a nursing intervention. So that is a step of the nursing process. Now I know sometimes UAPs will go get vital signs and they'll ask a pain level while they're here or while they're in the room. But if they just received a medicine and we're following up, that is a client assessment and evaluation of a nursing intervention. Option 2, assessing a client's ability to swallow food prior to feeding them lunch. So this one's probably the simplest one because we can see right away the word assessing and we know that is a step of the nursing process. And also this is a very high risk task. If that client can't swallow food and we feed them, what's going to happen? They're going to aspirate or choke and they can develop some life-threatening airway and respiratory complications. So certainly I agree with you guys. We do not want to delegate that. Option 3, assisting a client with pancreatitis to ambulate to the restroom. Yes or no? Do we want to delegate option 3? We can delegate that task safely because this is a routine task. Assisting the client with ambulation is routine and all it says is the client has pancreatitis. There's nothing there to indicate that they are unstable. So this is a stable client, routine task. I love it. So option 4, assisting a client admitted with a myocardial infarction to perform oral hygiene. So do we want to delegate option 4? Yes or no? So oral hygiene is a routine task and all it says is the client was admitted with the myocardial infarction. There's no indication that they are unstable. So routine task, stable client. I agree with you guys. Yes. Now this is where I'm going to give you one more helpful tip. Please don't ever read too much into an option or overthink it because you're stressed and you're nervous. You might say, oh, a myocardial infarction or a heart attack is, a very serious diagnosis. But all we're doing is oral hygiene. So don't start going down that rabbit hole, so to speak, because it can get you in a lot of trouble. Don't read too much into it. Option 5, performing perineal care or pericare on a client with an indwelling urinary catheter in place. So do you want to delegate option 5 to a UAP? Yes or no? So a lot of you guys are saying yes, delegate 5, and I agree. Pericare is a routine task, and all it says is our client has an indwelling urinary catheter in place. So it's routine, they're stable, yes. Let me give you an example of when this client might be unstable and it would be inappropriate to delegate. Maybe it says performing perineal care on a client with an indwelling urinary catheter in place, with bladder distension, with no urine output, with blood at the urinary meatus. All of these things would indicate that client is unstable and we should not delegate it. So option 6, recording the intake and output of a client with a history of CHF. So do we want to delegate option 6? Yes or no? So once again, recording intake and output on a stable client, because all it says is history of CHF. Routine task, intake and output, stable client. I say yes. Let me give you another example of when this would be inappropriate to delegate, just so you kind of know what to look for when you're doing an exam. If it said recording the intake and output of a client with a history of CHF who has pink frothy sputum. What does pink frothy sputum indicate? I'm gonna let you know that's a big red flag. If you ever see a test item that says a client has pink frothy sputum, that's a very bad, very ominous finding. So that's gonna be pulmonary edema, flash pulmonary edema, very dangerous. So if it said recording intake and output on a client with a history of CHF that has flash pulmonary edema, then that would be a no for delegation, okay? So last one, and this is the one that I think is the hardest that students struggle with the most. Performing vital signs on a client that just returned from the cardiac catheterization unit. So do we want to delegate option 7? And once again, this one is a little challenging because one of the most routine tasks that we ask UAPs to perform quite often is vital signs. But remember, we always have to look at the context of the item. Paul, good job. You said unstable client, and that is correct. This is another helpful tip. Just returned from the cardiac catheterization unit. So remember on the last item, we said anytime it says just arrived, just admitted, Same thing here, another helpful tip. Just returned from a procedure, they are unstable. So that registered nurse is actually the one who is responsible to go to that bedside, assess that client, and get those vital signs. So that is an unstable client. Y'all got them correct. 3, 4, 5, and 6.